Well, as we continue to track the numbers day to day, we've talked a lot about how COVID-19 is affecting some communities more than others. Tonight, we're hearing concerns of a group that's missing in a lot of that data, Native Americans. WMAR 2 News' Ray Strickland explains why the group says Native Americans can't get the help they need without any official numbers.
The numbers show COVID-19 is hitting communities of color especially hard. According to the state health department, African Americans have the most cases in the state with more than 26,000. The Hispanic community is next, followed by white Americans. But the next group of cases don't include race. The patients under data not available and other make up more than 18,000 COVID-19 cases in Maryland.
I cannot tell you with any certainty how COVID-19 is impacting my community. And the reason is that our data isn't counted.
Carrie Hawk-Lassard is the executive director of Native American Lifelines. It's an American Indian health and service provider serving more than 1,000 Native Americans in the Baltimore region. She believes a good number of those cases could potentially be American Indians and Alaskan Natives.
I would like to know who they are because I know people in my community who have been tested. I know people in our tribal community have passed away because of COVID-19, and it's not reported anywhere.
Hawk-Lassard says Maryland is home to more than 17,000 Native Americans, as well as several tribes, many of them dealing with issues well before the pandemic.
Our communities have higher poverty, less employment, less educational attainment, more, again, high-density housing. So those issues, those public health issues are serious.
Those problems are now even more serious because of the coronavirus, which is why she says including them in the racial breakdown of virus data is crucial. And so groups like hers can give Native Americans the help they've desperately needed for months.
Having that information, it's not always just about money. It's making sure, if people are suffering from this condition, let's get the resources where it's needed. But if you don't know, you cannot get the resources where they need to be.
In Baltimore, Ray Strickland, WMAR 2 News.